And welcome back. Well, according to the World Health Organization, low back pain is the leading cause of disability worldwide. Is that you? Today, a treatment designed to help you achieve relief for low back pain, herniated disc, sciatica, and so much more. Joining us now is Dr. Jonathan Stevenson. He's with Strive Integrative Health to discuss the Back on Track Spinal Traction Treatment. I'm excited to hear about this. Good to see you.
Yeah, good to be here. It's always a pleasure. Thanks for having me.
Absolutely. I think a lot of people have seen or heard of spinal traction, but they really don't know much about it. So tell us a little bit about this machine and what spinal traction really is.
Yeah, that's a great question. So when we look at spinal traction, it's a great way to really take that pressure off of the lumbar spine to really help people that suffer with pain, sciatica, herniated discs, and a lot more. Even our neuropathy patients do really well with it. So it's a very light, gentle, but effective stretch for the low back.
So can most people do it if they have back issues? Because I'll tell you, when I've had back issues, I've had sciatica before, I've had pinched nerves, and you don't even want to move half the time.
Yep. Very safe and very effective for a majority of people. Of course, someone who's had a previous spinal surgery, maybe they might not be a good candidate for it, but there's a lot of patients that come in that have had previous spinal surgeries that can still use it. So very safe, very effective. Of course, we always want to dive in, do a full consultation, really start to understand our patient, what goals they're coming in with, so we can really help them achieve that, whether that's in our office or doing stretches, exercises at home as well.
So as we were watching that animation, I was like, oh, this is interesting. So how exactly does the machine work? So it looks like it's kind of opening up some of those lumbar regions. I don't know if I'm saying that right. You can speak to that.
Yep, so you have these shock absorbers in between your vertebrae known as...
That's the little gray things right there?
Yep, those intervertebral discs. So when we look at that, those are the ones that can become compressed and put pressure on the nervous system. So what we want to do with this stretch is really help open those up and really rehydrate those as much as possible. We can even see that on post x-rays for our patients where that space starts to open up more. We've even had patients that have gone into their yearly checkups.
And they're taller?
They're taller.
I knew you were going to say that.
Yep.
I've heard that before, yeah.
So if your doctor is telling you that you're shrinking, this is a good option to really get, an inch or two back, for our patients to help with good, healthy posture and just functionality for that spine.
So tell us how it works in terms of treatment, because as I'm seeing there, it doesn't look like you're going all the way upside down either. And then how often do you need this? How quickly do you see results? What are you finding?
For a lot of our patients, they can see results in that first week. So we could be seeing them up to, 3 times a week in the beginning, and then slowly start to taper off so they can maintain those results long term. But what it does is brings you back into zero gravity, which is going to help take that pressure off of your low back. And then when we provide that traction, it actually creates more of a pumping mechanism to help hydrate that disc as much as possible. Very comfortable for our patients. It becomes their favorite machine when they come into our office. So luckily they weigh 300 pounds, so patients can't walk out the door with them because most of our patients would like to do that.
Yeah, just take it home to do that all day long. Well, this is much less intimidating seeing this than what I imagine. I don't know why in my mind I thought you had to go upside down. Maybe that was an old thing. But so in terms of the results and how long do they last? Because you're saying how quickly you can find relief, but how long is the relief lasting?
Yep, so it's great to really sit down with our patients and find what's contributing to that low back pain. A lot of times these patients that come into our office have had it before. It's a chronic reoccurring issue for the patients.
Yes.
So what we want to do is identify that trigger within their lifestyle, whether that's work, how they're working out, or maybe just a lack of movement. Maybe they're sitting too much too. So we want to get them to a good place, but also give them tips and tricks at home for stretches and exercises to really make sure they never go back to where they were when they first came into our office.
And is this safe for someone who knows they also have neck area issues, like up here, and obviously we've talked about low back?
Yep, and a lot of times they can be correlated. The whole body's connected, right? So we have to look at the person as a whole to help them get their best results. So when we look at that, that's why we have a lot of different modalities in our office to really give the patient the best option. We always call it biostacking in our office. We have a bunch of different modalities that really amplify the effect of each other to get the best outcome for our patients.
So how does it work? Someone comes in, you can kind of do an assessment and find out if this can work, or can they even try this on the first visit?
A lot of our patients try it on the first visit.
I would want to.
Yep.
Yeah.
So then they can really start to experience the relief. Like I said, a lot of our patients feel better after that first traction, after that first visit. So to really let them see what the benefits are from it, and then of course give them the recommendations moving forward to help them achieve their goal. You know, whether that's walking more, exercising more, or, you know, just getting ready for baseball season.
Yeah, there we go. All right, I know you've got a great option to meet with you, so I'm going to share that as well. Thank you so much for joining us.
You're welcome.
Appreciate it. All right, Strive Integrative Health says start your body transformation now. They are looking for 15 motivated people to experience this life-changing pain relief. For a limited time, the $249 package is just $49. It includes your back on track spinal traction treatment, free vibration session, and a free consultation. All you have to do is call and be one of those first few people. It's 262-649-2438. Or for more information about their clinic, go to strive-strive.com.